All right, thank you so much, Dow. The summer heat wave rolls on. We tied the all-time record of 117 degrees on Sunday, and these triple-digit temperatures, they're not going away anytime soon. The 4th of July just around the corner, and this morning we have some preventative tips to keep your family safe if you're heading outside to celebrate. Dr. Kimball Huang, he is with Healthcare Partners Tenaya Clinic, and he joins us now with more. Hello, sir.
Morning, sir.
Whew. It's been hot up there. The heat's scorching the past few days, 4th of July. Most people are going to be outside. What advice do you have for people who are still planning to be outdoors during the 4th of July weekend?
Most important, we always want to try to address children and also elderly folks. They're the ones who are most at risk for dehydration and also heat emergencies. Symptoms such as severe headache, nausea, severe heated skin are extremely important to pay attention to. If that occurs, the best thing to do is take the patient away from the heat or take the individual away from the heat.
Move.
And ultimately, you might need to call a physician if they're extremely dehydrated and fluids alone, oral fluids alone, won't be enough to rehydrate them.
Yeah, I think a lot of people, they don't drink until they feel thirsty. But once you feel thirsty, you're already dehydrated.
Yes, very much so. Yeah. Unfortunately, your sensation of dehydration or thirst is not a really good gauge of whether you are dehydrated or not. It's always important to constantly stay hydrated. We always recommend carrying a bottle of water with you all the time, especially when the temperatures are about 100 plus.
Okay, so let's talk about then sun exposure. I mean, how often should we be applying sunscreen? I buy SPF 50 because I'm Irish, and I'll lose that fight in a second, but that's what we should be wearing, right?
Absolutely. The most important thing when you're talking about sunburn or overexposure is try to avoid the overexposure. The CDC has said that the highest rate of UVB rays are between 10 a.m. and 4 p.m.
Okay.
During that time, we always recommend that if you can stay covered, that's the best thing. Yeah. If you need to have suntan lotion, apply it quite often and regularly, and use an SPF at least greater than 15. Absolutely.
So we should be wary of that. A lot of people, kind of out of sight, out of mind, they don't really think about wearing the sunscreen. Oh, no, it's just a tan, but that can be incredibly harmful for them.
Absolutely, and also the sunscreen will be very protective of your for sunburn.
No question. Well, let's talk about some of the less obvious heat-related health issues that seem to come around this time of year. People host the barbecues, picnics. What should they be most mindful of those situations?
Food poisoning is incredibly common this time of year, unfortunately. A lot of it is due to poor refrigeration or your food isn't cold enough, whereby you're allowing bacteria to grow. Common signs of food poisoning are nausea, vomiting, diarrhea, diffuse muscle aches. The best thing to do is when you're planning a party for things that are perishable, like dairy products or mayonnaise, to always keep them well refrigerated.
Yeah.
For barbecues, keep food that is raw or unprepared away from prepared foods. When you're talking about a barbecue, keep your hamburgers away from your buns.
Don't cross-contaminate.
Exactly. Also, make sure that when you're cooking, you might want to use a meat thermometer. That way you can ensure your meat is thoroughly cooked through.
Absolutely. I think a lot of people, they'll just take the meat outside and they'll wait for like 30 minutes to an hour before they actually put it on the grill, and that's where all of these, you know,
microbes.
They start growing.
Absolutely.
So take it out of the fridge and cook it right away.
Exactly.
All right, cool. Now, what about the fireworks? I mean, we see Vegas get lit up every 4th of July. What should we be wary of there?
The most important thing is make sure that you're using fireworks that are safe and sound, or at least fireworks that are legal.
That's a good step.
Always make sure that children are away from fireworks, away from lit fireworks. Keep your body parts away from them. And also, for a general safety point, after the fireworks are all lit and finished, soak them in water. You don't want to start a trash fire later by some burning embers.
Absolutely. Have you noticed that 4th of July safety seems to have gotten better over the years? Like, I was at a 4th of July party last year, and it seems like they did have the water, where 10 years ago, I remember my family trying to light off fireworks. They never had the bucket of water.
I think that we just are addressing better common sense.
Yeah.
Ultimately, I think we need to be aware of our concerns with dealing with fireworks and dehydration, and also alcohol. You should always be cautioned when you're have drank all day, and whether you're going to operate a motor vehicle or even swim.
Yeah.
The most important thing is to exercise just good common sense.
No question. So if we are feeling a headache, definitely get some water in us. Be safe with our fireworks. Don't let the meat rot outside before you cook it. And use a meat thermometer to make sure you cooked it right.
Absolutely.
All right, cool. And if we want to learn more about Healthcare Partners, I know you guys have a total care model. Tell us about that approach and why you like working for them so much.
The total care model is that we involve everybody, from the physicians to our subspecialists, the primary care physicians, to give you the best care possible. That's the nature of Healthcare Partners. We try to involve the patient is ground zero and give them the best information we can regarding their care, their health maintenance, and also their future care in terms of should a problem effectively occur.
All right, cool. And really quick, how many glasses of water should we have a day?
At least 8.
There we go. There it is. See, that was very quick. Well done. Thank you so much, Dr. Huang.
Thank you.
Again, if you want to get a review on all the things that we were touched on upon a summer safety check, just go to our website or call the number on your screen. Dr. Huang, located at the Tenaya Clinic. All right, still ahead on the morning.